Good morning. My name is Dr. Shriram. I'm a vascular surgeon. I used to be the head of the University Hospital Vascular Department in Singapore, and my background is from the United Kingdom. I'm here to speak to you about drug-coated balloon angioplasties or drug-eluting balloon angioplasties and the new biovascular scaffolds. A lot of people misunderstand what an angioplasty does. The general perception is that an angioplasty is about opening a blockage by stretching the artery and that it is a purely mechanical action. That is not true. What we actually do in an angioplasty is, of course, we open the artery for that moment, but we also create damage to the arterial wall deliberately. We deliberately damage the arterial wall so that the arterial wall will remodel itself as it heals, remodeling itself into a healthy artery. And when you do this kind of damage to the artery responds by trying to grow back cells, and sometimes those cells can overgrow. And when those cells overgrow, you get the blockage coming back. And that's the basis for all the drug-coated technology. You release a medication along with the angioplasty so that the cells do not grow back too quickly, and therefore blockage does not occur for much longer. So although drug-coated technologies are a little more expensive, your chance of requiring a second procedure fairly quickly is far reduced. For this reason, drug-coated technologies have become quite popular. There was a period of time when the primary drug used to be paclitaxel, which was initially developed for breast cancer. There have been some publications and research that this might be a problem, and we have switched to another medication called sirolimus, which is also used to coat the balloons. Recently, a randomized control trial was completed from Singapore for angioplasty with sirolimus-coated balloons, which shows excellent results. But the problem we also have in Asia is that many of these patients have a lot of calcium in their arteries because diabetes is the common cause for this kind of disease. And so while the balloons work for normal cholesterol kind of deposits, when there's a lot of calcium, you need something more than that to try and keep these arteries open. And so we have used stents in the past, but the problem is that the stent is a foreign body and it stays inside the artery for a very long time. It doesn't come out. And so the new technology of biovascular scaffolds allows you to keep that in place while the artery is remodeling. Combining drug-eluting technology with things like sirolimus, with a scaffold that is there for the period of time that you need it and then gets reabsorbed over time, that seems to be the ideal solution. And the way forward in peripheral arterial disease, mainly from diabetes and below the knee, may well be that we will be using drug-eluting biovascular scaffolds in the future. I hope this helps you understand the technology and what angioplasty, drug-coated angioplasty, and biovascular scaffolds are. Thank you.